My name's Amanda McClelland. I'm Australian and I currently work for the Australian Red Cross on loan to the International Federation of the Red Cross, and my role here is as Senior Officer for Emergency Health. So I look after health operations in disasters. I started as a nurse, as a paediatric nurse actually, and my specialisation is in communicable disease. So I have a master's in public health and tropical medicine, and then another degree in disaster management and refugee health, which all built on my nursing career. My job really revolves around clinical primary healthcare and public healthcare in disasters. I chose this profession, actually I'm not sure if I chose it, I think it chose me. I started as a paediatric nurse, which I love, and I love working with the kids, and every step just kind of evolved. I started working with Aboriginal children in Australia, and in the hospital I saw lots of problems and the same children coming back time and time again, and I went to Aboriginal communities and started working there, and actually I went on holidays to Africa and saw that the conditions in Africa were worse than in Australia, but the kids were actually healthier, and that there was a different approach to health, that there was a much more ingrained public health at a community level, and I started to look at that and investigate it, and actually it just kind of stepped in terms of me trying to find solutions for the health problems I was seeing in my own country. It's an interesting mix actually. You have to be very technically competent. Obviously you need to know, in terms of emergency health we cover everything from epidemics of Ebola through to cholera. Sometimes we're looking at gender-based violence and reproductive health, HIV, but then we have earthquakes where we need to be able to advise on surgery. So actually our task is very, very broad within the Federation in terms of the health sector. You also need the soft skills, how to work with communities, how to approach communities in distress. They've had major earthquakes or major disasters, and you need to work with them to find solutions. So it's a very mixed role. You need a calm personality, you need to be good under crisis, you need good teamwork and management skills to move people forward, but you also need the technical skills to be able to identify problems and issues going forward. Positives are I get to travel, I get to be, as a nurse, I get to work outside, which I love, so I get to drive around in 4-wheel drives and fly in helicopters, but a lot of the time I'm in the office doing paperwork and doing large proposals, looking for money and funding to do what we do, so that side of it for me is a negative. I don't like that side, but it's a side that we have to do. So it's not all outside running around Africa and doing stuff. A lot of it is in the office and phone calls and coordination and meetings and workshops, and they're still good, but I prefer the stuff outside. There's been a few. I think working in the tsunami was the first time that I really worked with a community that had been completely devastated, but to see the cohesiveness and the will of the community to build back and to assist one another was amazing. All of my staff had been touched by the tsunami and had lost family, but they were committed to helping other people, and we worked extremely long hours and extremely difficult circumstances, and they just kept going, which was amazing. But I think also, I've worked in conflicts as well, and obviously those are always very difficult to see the impacts of those outside of your control, and you can only do what you can do under the limitations of the security that you have. So each mission and each different context adds something, and I take something away from all of them. Actually, I didn't think I'd be able to come back to a city. I come from a small town in Australia, and then I've spent the last 7 or 8 years in very remote locations, mainly in Africa, and even smaller places in the Pacific. And I really didn't think I'd like to come to a city. But Geneva's a great mix. I love the lake and the mountains. There's plenty of activities to do. And I don't speak French, but I still find it quite easy to get around. There's a good expat community, but the local Geneva people are also very open and welcoming and do their best to help me as I struggle with my French. And yeah, so I think the international flavour here is excellent, and yeah, I've felt at home for the last 12 months, which has been great. There's a lot of benefits to being flexible and being able to go where the work is, and to be able to follow your dreams and where the interesting work is. You're not confined by getting employment just where you live. You can go where you find the work interesting, and that's what keeps me moving from place to place. I go where the most interesting work is, and I get to go to places that you would never get to go. You know, there are no tourist trails where we go sometimes, and we get to see amazing things and work with incredible communities, and I think that's the big benefit.